IPEX is an immunodeficiency caused by defective regulatory T cells. It is characterized by a triad of early onset enteropathy, endocrinopathy, and dermatitis. You'll need something warm for our expedition to the Arctic, where we'll go over our visual mnemonic for IPEX. You can't get anywhere in the Arctic without an ice pick. There's no other way to scale the slippery glaciers. I picked this ice pick to be our symbol for IPEX. Get it? Ice pick for IPEX? IPEX does stand for ice pick after all. Actually, IPEX stands for immune dysregulation, polyendocrinopathy, enteropathy, and X-linked. This sounds like a lot of information, but don't worry, we'll cover each of these in our scene. Ice pick aside, a cane is handy for these expeditions. You know, those canes or walking sticks used by mountaineers to scale the slopes? A cane also happens to be our recurring symbol for immunodeficiency. You know, since canes are used by those with weakened conditions, and immunodeficiency just describes a weak immune system. This cane should help you remember the immunodeficiency or immune dysregulation seen in IPEX. This is again what the I in IPEX stands for. Next, let's discuss how exactly IPEX works to weaken the immune system. So why has our expedition stopped on this mountainside? Looks like we're stopping because one of our guide animals has collapsed. Yep, this Arctic fox was guiding us down these tough slopes when it collapsed due to the terrible cold. It's so sick that it's even leaving a trail of fox poop on the slopes. By the way, this fox poop is our recurring symbol for FOXP3. Get it? Fox poop for FOXP3. And this fox is dying, which should remind you of the defect or mutation in FOXP3 that causes IPEX. FOXP3 is a transcription factor that plays a major role in a differentiation and function of regulatory T cells. We have a dedicated scene on these regulatory T cells, or Tregs, but in general, these cells are responsible for suppressing or regulating the immune system to suppress excess inflammation, prevent autoimmunity, and facilitate wound repair. A mutation in the FOXP3 transcription factor therefore leads to defective T regulatory cells in IPEX. This dysregulated immune system is basically the cause of all the symptoms of IPEX. Just picture this dying fox to remember the importance of FOXP3 mutations in the pathogenesis of IPEX. Now that we've covered the FOXP3 mutation that causes IPEX, let's move on to the inheritance pattern for IPEX. For that, take a look at what the expedition leader is holding in his hands. Yep, he's holding a small cross to say the fox's last rites. Let this small cross be your symbol for the X-linked recessive pattern of IPEX. You know, since a cross is shaped like the letter X, and it is a small or recessive cross on the necklace. The X in IPEX also stands for X-linked, if this helps. X-linked inheritance is important to remember because it means that the disease is usually seen in males. Since IPEX is such a severe immunodeficiency, it often presents in infants. So for test day, you should be thinking of IPEX generally in the context of baby male patients. Let's talk about the exact clinical presentation of IPEX next. It's cold out here. As mountaineers, your gear is everything. That's why I swear by these red coats. Mountaineers always wear this red gear since the bright color will stick out in case of an emergency. These red coats are also our symbol for the eczema, or atopic dermatitis seen in IPEX. Get it? These coats are an outer covering, kind of like the skin, and they are red, kind of like the red rashes seen in eczema. Eczema is one of the most common presenting features of IPEX. Since IPEX leads to dysfunctional Treg cells that can no longer keep our immune system in check, it makes sense that patients with IPEX would present with various autoimmune conditions. One of these is eczema, caused by an autoimmune response in our skin. Back to the fox, notice how it is kind of released a number 2 in its last moments. Not the prettiest picture, I know. But this diarrhea should remind you of the diarrhea and enteritis seen in IPEX. You see, in addition to autoimmune disorders of the skin, defective FOXP3 and Treg cells can lead to autoimmune damage to enterocytes, resulting in diarrhea. The E in IPEX stands for enteropathy. which really just manifests as chronic diarrhea. The enteropathy is severe enough to be life-threatening, as we see here with the fox. For our last symbol, take a look at the other climber in the back. While the expedition leader was conducting final rites, this person has taken advantage of the break to rest and power up with a high-sugar candy bar. Still, this person looks pretty pooped out, like really tired. This fatigued and tired climber should remind you of thyroiditis and thyroid disturbances seen in IPEX, since fatigue is a result of thyroid defects like hypothyroidism, right? And the high sugar bar should remind you of diabetes, which is just a disorder of high blood sugar. Diabetes and thyroiditis are two examples of the autoimmune endocrinopathy seen in IPEX. The presence of multiple endocrine abnormalities, or polyendocrinopathy, is a classic finding of IPEX. The P in IPEX stands for polyendocrinopathy, after all. Basically, autoimmune damage in the thyroid, pancreas, and other organs occurs due to impaired Treg function. The classic presentation is a male infant who presents with diabetes and low thyroid hormones. If you see this in a constellation of eczema and diarrhea, be on the lookout for IPEX. The expedition leader has just finished the last rites. Let's recap and head back down to base camp. IPEX is a severe X-linked immunodeficiency caused by a loss-of-function mutation in FOXP3. This impairs the development and function of regulatory T cells. Loss of Treg function results in widespread immune dysregulation and autoimmune damage. Clinical features include immunodeficiency with recurrent infections, as well as autoimmune enteropathy, endocrinopathy, and dermatitis. Time to go. Catch you in the next one.